So there is a disease termed idiopathic pulmonary fibrosis, IPF, and we always think about how do we bring our basic science into our patient care. There are some very exciting therapeutic options for those, and that's going to be presented at a symposium in conjunction with discovery related to other journals, for example, the New England Journal of Medicine. So that's a big highlight. The others that I'll speak about is health equality, and why do they say that? Because that impacts so many of our healthcare professionals and our patients. So for example, we have a presidential symposium occurring today. We have the head of the NHLBI, as well as a faculty member here at UCSD who has really led a student-run free clinic. So that's going to draw a lot of attention because there'll be someone for everyone, science and social justice. And the other part that I'll talk about is that there are many new and exciting aspects that have to do with day-to-day care of our patients. So implementation science of bringing our guidelines to our patients. So in that light, sepsis has been a huge theme throughout the organization, and there'll be a symposium focused on that. But related to that, some of the very compelling issues have to do with e-cigarettes and how they impact a vulnerable population of children. So some very exciting basic science showing that e-cigarettes can impact your ability to defend yourself against these drug-resistant pathogens. So for me, I see those as three topics that really link the science and our focus on health quality. I think there are several exciting opportunities, and the reason I say that is I'm shamelessly hoping to recruit others with the same passion and commitment of taking care of patients with lung disease. I think one big opportunity is that we are limited in some of our specialists. So intensivists, for example, the number is declining, or perhaps the number of the next generation that we can commit. So with that, our focus at the conference, and that we're very, very dedicated to, and all of the presidents, including myself, and that will be coming behind me, are committed to the next generation. So it's the workforce. We're looking for our replacement. That's a huge challenge, and in addressing those numbers. The other part that I think is really important is trying to understand and implement regulations related to the Affordable Care Act, what it means, how to best do it, and how to continue it for our patients. And the third part is the diversity not only in the workforce, how to address that our workforce looks like our patient population, and to be able to recruit and retain the best and the brightest. The fourth part of that is that there is limited funding for the science. As you know, our motto is today's science for tomorrow's care. And it's again that integration of the science and the care of the patients that's so important. That funding is diminishing, that's a challenge. It can be a bit disheartening, but incredibly rewarding to pursue the kinds of fields that we're talking about. And there's a place for everyone. Whether you have a basic science interest or you want to understand how to give or use the best inhaler, there's a place for you now. So I think it's a great question, and it's one that we're all addressing. And so everyone is thinking about best efficient care, and that's why I raised one of the opportunities is how to think about implementation of the Affordable Care Act, but also how to evolve the best care of our patients. We as an organization have been involved with 3 other societies in these terms called choosing wisely. So trying to pick the sort of most important sort of basic rules which have to do with still providing fantastic care, but thinking a little bit about the cost of care. The other important part is that we educate our next generation, that in the same way that I would say, you know, really you can't use your iPhone, you have to use a landline, that would not be acceptable. So for all of our next generation coming through, we do have to consider cost, but never at the risk of diminishing fantastic care, excellent and outstanding care for our patients.
Okay. So is there anything else that you want to add, bring up, let our readers know about?
I think that it's an incredibly exciting opportunity for the entire next generation who care about making a difference. I talk about lung health. Lung health is not just one organ. It is one of the disease areas that's very important. We know about heart disease. Lung health is very important. We help the world breathe is one of our mottos. So it's important, but I think not just in the treatment, but in the prevention. This organization is very committed to that, so I'm going to underscore again the science and the aspect of thinking about science in relation to health equality. It's good not only for our patients, but it's good for all of society.